Our show today is brought to you by the Cascades Manor, located in the beautiful 465-acre Cascades Falls Park. The manor has wonderful banquet space available for weddings, gatherings, business, and of course, book your holiday party coming up at the Cascades Manor.
You should swing by the green room later today because Cascades Manor will be catering the green room.
Can't wait for Cascades Manor. The JSO Children's Concert is coming up on October 21st at 3 o'clock at the Michigan Theater. And adults are $5, kids are free. And that show starts at 3 o'clock, October 21st.
Joining us now is emergency services physician from Henry Ford Jackson Hospital and IEP Urgent Care, Dr. Jacob Sinkoff.
Hey, good morning. Thanks for having me again, guys. Congratulate her anniversary.
Today, yes.
Today, actually, mine's tomorrow.
Really? Happy anniversary.
Thank you.
How many years?
This will be our 4th year.
Oh, wow.
Fourth year.
Wow.
Yep, and I remember when we got married, the weather was beautiful, too.
Yeah.
So,
October's a popular month.
Yeah.
Were you on Sweetest Day?
no. Oh.
You probably were.
Kim would know. My wife would know.
What was your wedding song? Let me ask you a bunch of questions about your wedding, see if you remember.
Yeah, I actually think it was. For some reason, that's ringing a bell now. So, wasn't that's a Hallmark one, isn't it?
It is a Hallmark
made-up
holiday.
holiday. Sweetest Day.
Sweetest Day. Yeah. When is that?
It originated
yesterday?
in Cleveland, and it was a chocolate company that started it.
Yeah.
According
Okay.
to
Oh, so it wasn't Hallmark.
Gilbert Chocolates and Sally Critchbaum. Is that what she said yesterday, Brandon? Chocolate? Yeah.
Okay.
I feel like when it first started, it was bigger, and now it's kind of just
Yeah.
hit the
Well,
I
back.
think
maybe
it's
in
an
your
excuse.
family.
Yeah,
I think it's really an excuse for like high school kids to get their boyfriends and girlfriends something, if you ask me.
It really is so that anyone can give anybody anything.
Sweetest Day's on Saturday.
Yes, it's always a
They're telling
Saturday.
us.
Okay, Saturday.
Very
Dave
good.
Okay.
Rice, of all people who
Dave Rice. Dave, do you have a sweetie you want to tell us about?
No.
No, he doesn't.
Is it always on the weekend?
Yes.
It's like, okay, yeah. So
Yeah.
I think I'm pretty
Must have
sure.
been.
Yeah, I'm pretty
Must
sure.
have been.
I'm pretty sure when I got married, it was on
So
Sweetest Day.
before the break, I said we're going to learn about what the most popular common reason for an ER visit is. According to wherever you look, it's either a headache or abdominal pain.
I want to guess. Can I guess?
Yeah.
Applebee's.
Applebee's.
Jeez.
I don't know if I should say all the. Actually, I think
Actually, yes.
one of the ones we used to. The restaurant is not in business anymore. But
We should say it.
What was the name? I think it was Finley's. Is that?
Finley's?
Was it the
How many
place by
people-
the mall?
Yeah, you had people coming from the ER to Finley's after the meals?
From Finley's right
From
to the
Finley's
air?
Theater.
Brandon.
I don't know off the top of my head. A couple of times I remember. I think I could say it now because I don't think they're in business. But a couple times every once in a while. But and it's in medicine I say correlation doesn't equal causation.
Yeah.
Maybe it was something they ate for lunch and that
course.
sort of stuff. But we haven't had to deal with a big outbreak of contaminated food or fish and stuff like
good.
that. So yeah, usually with food poisoning, there's a couple different ways you can get food poisoning. If it's sometimes you can get food poisoning within an hour or so of eating food, and those are caused by actually pre-toxins.
Right.
The food is like fish is not kept well, bacteria grow.
And you
that.
feel like,
Oh,
I
yeah.
got the quick flu.
Yeah. So what happens is bacteria grow on that fish, and they make these preformed toxins. So right when you ingest it, the toxin's already there, so you get sick really quick. So sometimes food poisoning can happen really quick. Sometimes it takes 12 hours.
There's nothing worse.
No.
And
It's been going around.
Where's the
Jackson
worst
County a
place
little bit.
Where's the worst place you would want to get food poisoning? And I'll tell you, Bart's had it there.
Oh yeah, well, I heard
Disney
you-
World.
Disney World or an airplane?
Disney
I don't
World
know which
and
one.
the airplane.
Disney World couldn't get on the airplane
Yeah.
because of the food
Oh
poisoning.
goodness. Oh goodness. Would you guys poison them to stay at Disney World?
This burger he ate.
Yeah.
No,
This was a
I
very-
know what it was. It was the waiter in that last restaurant. He had his thumb on my plate when he brought my food.
No, they're not
Yeah,
trained to
probably
deliver food
right.
like that.
Yeah,
I don't think so.
Not at Disney, but
No.
yeah.
I want to compliment IEP Urgent Care. I was there about a month ago. Dr. Peter Bullock delivered me some bad news. After 3.5 years of avoiding it, I got it, the COVID.
I haven't had it COVID
Really?
yet, so hopefully it's...
Me neither. And I'll tell you what, he's turned into a completely different person post-COVID. I don't know if you've noticed
I
that.
didn't notice.
I'm just kidding.
I'm tired, I know that.
Well, that's nothing.
I think I have long COVID.
Yeah.
Well, you might.
Yeah, maybe. Yeah.
So I'm hearing, I was just somewhere yesterday and they said, hey, has your kid been able to avoid the ick that's going around? And I'm thinking, yeah, what is the ick that's going around?
So we've been seeing a lot of GI stuff recently. So I think with school starting, a lot of nausea, vomiting, diarrhea, caused likely by a virus. Usually can last a couple days, sometimes a little quicker. And we're getting to the time where the respiratory viruses are going to start coming through. I haven't seen much of it quite yet, but especially with the changing seasons, with our asthmatic kids and more staying indoors are what kind of cause these viruses to start wreaking havoc on everyone's lives with kids. So
Excuse me.
Okay.
I know there's something in my throat. I got the flu vaccine and the RSV vaccine.
Yep.
Okay.
At Brown's
Nice. Very
Advanced
nice.
Care on
Very
Monday.
good.
Yeah.
Very good.
So RSV is emerging as, everyone knows it for kids, extremely common. Pretty much every kid will have it at least once by the time they're 2.
Yeah.
So it's all, no matter what, you're gonna get RSV. Obviously, taking precautions, washing hands, stuff like that. And they actually have RSV vaccines now for kids and even pregnant mothers, which help decrease the severity, decrease the risk of hospitalization in kids with RSV.
When should we get our kids the RSV shot? Is now a good time?
I would say probably right about
Right
now.
around
If
now?
you talk with your pediatricians, probably about now. Same time with the flu vaccines, you're kind of your body's kind of triggers. You have peak immunity as we come up into the peak seasons of the flu also. But yeah, as we age, increased risk of RSV, and it's leading to more knowledge that RSV isn't just for kids. It can happen at any time.
Yeah.
So
Here's an interesting ER stat and question. I know you like that type of thing. What state has the longest ER wait time on average in the country? I'll give you a hint. It's 228 minutes.
Wow.
228 minutes.
I would say California.
No,
Let's say Florida.
Maryland.
Maryland.
And they say it's due to the lack of the primary and behavioral health services in that area.
Yeah.
But I mean, that's absurd.
Yeah.
But when you take a look at wait times, Michigan's not bad at all compared
No.
to some of these states. And is it a lot of times people are just coming in because they don't know where else to go?
A lot of times, especially nationwide, is just a lack of, kind of primary care resources, education, and, insurance is obviously an issue too, where, we'll see anyone no matter what. If you don't have insurance, people.
If you're a primary care physician, you can open shop and just get right to it.
Yep.
You know what I mean?
Yeah, and they're the primary care physicians we do have are very are very busy. So there's obviously a need for more primary care physicians. But they work hard. And I think with the advent of medical records, they get messaged by their by patients all the time. So they a lot of administrative work being a family medicine or primary care physicians nowadays. So their work's hard.
Yeah, I went to my primary care physician last week, and it was fast. In fact, the online survey afterwards took longer than the actual visit.
I just found out this week that I thought I was going to a pediatrician, and it wasn't the pediatrician that I was seeing when I was a kid. He just told me that.
Yeah, so
I didn't know that.
Yeah, so family medicine physician. I'm assuming you went to a family medicine physician, so you can take care of anyone at any age. Internal medicines that physicians that do primary care would generally see patients over 18 years of age. So, and then back not that long ago, family medicine doctors would deliver they were on call 24/7. They'd see kids, they'd deliver babies, they would take care of the whole family, one-stop shop.
Not only was your physician not a pediatrician, he was a specialist in senior care.
Why did I call him doctor when I went there?
Oh no, Dr. Marvin Fields. Was the
Dr.
doctor,
Fields, I know.
But his PA, Kevin Taylor, you thought he was a doctor?
You guys had me calling him Dr. Taylor the whole time.
Oh, we call him doctor and make him feel good.
Yeah.
I mean, he did all the doctoring.
Yeah, you did. All right. I survived.
Yeah.
I survived.
Yeah, you made it. I mean, Yeah.
It did make up.
He was a great PI.
Yeah, Dr. Taylor.
Dr. Taylor.
I don't think Dr. Fields must be retired.
Dr. Fields, yes.
Yeah.
Both, actually, Kevin Taylor retired.
Yeah.
Wonderful. We'll have to send him this clip.
No, when Dr. Fields, he sent us a letter and said, I can't treat you anymore, you're not old enough. Because he was transitioning to older care for older adults.
Gotcha. Yeah. So with the some of the nurse practitioners or APP, they specialize, or you can specialize in certain types of, you can do adult medicine, you can still do family medicine. So yeah, they have some of those same restrictions and kick you out if needed.
Well, let's hope our viewers don't need to see you or anyone else in the ED or at IEP. Keep healthy, stay healthy. Get vaccinated, right?
Absolutely. Yep.
Thanks for coming in.
Thanks for having me again.
Dr. Jacob Sinkoff from IEP Urgent Care and Henry Ford Jackson Hospital. More of the morning show right after this.